Brenda, you can see my screen, right?
Yes, I couldn't see the video, but I can see the slides, and I saw you advance them.
I haven't pulled up the video yet.
Okay.
Let me switch over and see if you can see it, however.
Yep.
Okay.
Good afternoon, everyone, and welcome to our session 4. We should be ready to start here in just a few minutes. I would like to invite everyone on the call so far today to go ahead and type your name and organization and email in chat if you could. This allows us to make sure that our email database is correct and that we can send out resources to you all as we get them. Thank you all for putting your name and emails in chat. I do greatly appreciate it. At this time, we do have a good group and it is 11 a.m. So I will pass us over to Nadine to get us started. And I will be monitoring chat. So if you guys need anything, please let us know.
Good morning, everybody. Welcome to our Project Firstline fourth session. We are glad to have you back. And last time we focused on the concept of respiratory droplets and how they're spread with how they spread COVID-19. And today we're going to focus on another way that germs can spread from surfaces to people. And since my screen changed, I gotta figure out if I can advance my slide. I lost my my slide advancer here. Okay. So here's our agenda. It's a pretty typical agenda for us. We welcome you all today, and we do have one video today, and we'll have some discussion to see where we are with things.
Nadine, we're seeing participant board. We're not seeing the slide.
Really?
Yes, ma'am.
Okay, well, let's see if I can figure that out. Heck, I'm gonna. Now do you see a slide?
No.
Heck. Cancel. It totally changed. I now see you instead of.
Yeah, I would stop share and then maybe reshare.
Okay. I'm seeing a 1. Do you not see a slide?
No.
Do you see a slide now?
No.
It's really weird. It moved me into a whole different mode of what I'm looking at here. Now do you see it?
It's yes, ma'am. Thank you.
Okay, we'll see if I can advance slides because I don't have the normal. So for today, there's 2 learning objectives. We're going to talk about you'll be able to tell us 2 ways that viruses spread from surfaces to people, and you'll be able to explain 1 reason why good hand hygiene and environmental cleaning are important in keeping germs from spreading in healthcare. Herein lies the problem. I can't advance a slide. Did you see the slide change? Okay.
Yeah, sorry, I was muted. Yes, you're on a new slide.
Okay. So, what do you think? This is kind of a pick your brain before we watch the video. We're going to talk about vocabulary. So does anybody have an idea or a definition for what a fomite is? And it's okay if you don't. Well, fomite transmission is is infection spread through direct contact with an article or surface, like a stethoscope that has become contaminated with infectious material. So when you see a doctor go from patient to patient and they don't clean a stethoscope, they're potentially spreading, or you have a stethoscope that you're listening to someone's lungs or doing something with them, and you take it from person to person, you're potentially spreading that. That's a mode of transmission. A fomite is a non-living object that's contaminated with microorganisms that can spread the organism to other persons. Contact transmission is infection spread through direct contact with an infectious person, like shaking hands or taking a pulse, or with an article or a surface that has infectious material on it. Any questions about that? Does everybody understand that concept? Okay, I see head nods. That's good. Oh, here's our definitions. I just read them to you, so now you can see them in writing. I won't read them to you again. I forget when these slides have activities, so. So we're going to move in. So although COVID-19 is spread through respiratory droplets, it's important to understand other ways that the disease can spread. So let's check in and see what Dr. Carlson has to say today. So we'll see if our video works today. Can you see the video? Well, here, you tell me what you hear.
Hi, everyone. I'm Abby Carlson. I'm an infectious diseases doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And welcome back to our Project Firstline video series, Inside Infection Control. We've been talking in this series a lot about viruses, specifically SARS-CoV-2, the virus that causes COVID-19. We've also talked about how viruses work and how they spread. And today we're going to focus on that last part, how viruses and other germs that make us sick spread. We know that we get sick with COVID-19 when the virus SARS-CoV-2 gets into our nose, mouth, and eyes. But other than breathing it in, how else can the virus get to those places? Well, quite simply, on your hands. When you touch something that has live virus on it, and then you touch your face without cleaning your hands first, you can get virus into your eyes, your nose, and your mouth. And so then the question comes, what things have virus on them? Well, more than you might think. And to understand why, let's go back to those respiratory droplets. We talked in an earlier episode about how these droplets have a lot of different sizes. And when they're breathed out, some of the very tiny ones are going to be caught in the air and carried away, traveling wherever the air currents are going. But a lot of those droplets are big enough, still small, but big enough that they won't travel very far in the air. Instead, they'll start falling towards the ground. You can think of it a little bit like leaves on a tree. A lot of the leaves are going to fall near the tree, but some of them will be caught by the wind and they'll move with the direction of the wind. They'll fall a little further away. Let's take that image a step further. Leaves falling from a tree don't just fall to the ground either. They also fall on your car, the roof of your house, anything that's nearby. Just like that, droplets, respiratory droplets, they fall on things that are nearby, like patient beds and waiting room chairs, desks, clothes. The list is very long. Once the droplets land on something, the virus can survive for at least a little while. It's not long for most surfaces, but it's long enough for you to touch that surface and for the virus to make it onto your hands. From there, the virus can get into your body if you touch your face without cleaning your hands first. And that happens. You're exhausted at the end of your shift and you rub your eyes, or you're running from place to place and you forget to clean your hands. It's one of those habits that's just hard to recognize and hard to break. In addition to droplets falling down, another important way that virus can get onto surfaces is when an infected person touches their eyes, their nose, their mouth, which gets virus onto their hands, and then they touch another surface, like a break room door handle or the keyboard in the nurse's station, an elevator button, an IV pole. Again, this list goes on and on. And these actions, they leave the virus on that surface that someone else can pick up on their hands. And it's gross to say, but for any of us who have been in healthcare, we know that the body fluids that we have, including spit and snot, can get onto things like linens and things near a patient. And if anyone touches those surfaces and doesn't clean their hands, they can spread virus around that way, from themselves to other surfaces to other people. Knowing all of this, we can see why good hand hygiene and good cleaning of the environment are so important for infection control, so that viruses and other germs that make us sick don't spread. We're going to talk a lot more about this in other videos because it's a big topic that applies to many diseases, not just COVID-19. In the meantime, thank you for joining us. As always, please don't hesitate to follow up on Facebook or Twitter, or check us out online at cdc.gov/Project Firstline. We'll see you all at the next episode.
Now you should be seeing my slide again. Okay. So as we think about what Dr. Carlson talked about, oops, didn't mean to do that. I gave you all the answers. I wanted to ask you all what are some key messages that you heard in that video? And you can type this into chat or feel free to unmute yourself and talk. We like to hear other voices besides our own. She really had two key messages. What were those key messages? Are we getting anything in the chat, Brenda?
Yeah, we just received one in chat about washing your hands very frequently.
Okay. And how is the other way that the germs spread? Has to do with inanimate objects.
We have a comment in chat about cleaning surfaces, but I chuckle with the keep your hands away from your face because, and then there's another with touching your face because that's always my bad habit. And I knew we were talking about that today and I struggled. So you just being self-aware of your bad habits because I'm really bad with that. So, but that's a big one. Keeping your hands away from your face, touching your face and then touching something else. Clean your stethoscopes and your equipment frequently. That's a great answer. Respiratory droplets travel to other surfaces, and it's not always near the patient. It could be in other surfaces that are within that care area.
Absolutely. And I am, you guys witness me full throttle touching my face because I have allergies and my nose itches like crazy right now. And you guys probably watched me rub my nose because it does itch. So it is hard. And the key thing is to remember that if you need to make sure that you are washing your hands in between each of those things. So, what is the hardest part about protecting ourselves from germs that can be spread from surfaces or that can spread from surfaces? Feel free to type things in chat.
We do have one answer in chat, and it was kind of came in between slides, but I think it still fits. And it's about touching the face, but droplets spreading to surfaces like the doorknobs and other surfaces that are within that workspace. So, I mean, that is one of the hard parts as well. Someone commented about, again, body awareness and face touching, recognizing bad habits and then changing them. So on the changing part, again, that we can do it as long as you're aware. I hold a pen during these sessions because that'll keep me from touching my face. I'm always holding something. But how do you guys have these conversations with your clients and the people that, as you're educating them when your your little time of touch points with them, how are you encouraging these concepts for them to be safe within their own care area?
That's a really good question, Brenda. I would like to hear what people have to say about that. Especially those of you who work with the developmentally delayed people. It's really hard to get those concepts through.
Yeah, we have a comment, just constantly reminding them to keep everyone safe. We must constantly watch and wear our mask. So constant reinforcement and education.
It takes a lot, and it takes a village for us to remember. And sometimes we have to be visible and audible reminders for our peers as well to practice good behaviors. And so we all need reminders. It's kind of like when you're doing public speaking, and it's a good idea to record yourself because you then recognize how many times you say those things that irritate the heck out of people that you're talking to, and what those things that you begin counting what they're saying because you're hearing it so much. So
We
it
have
is.
some, oh, sorry.
Go ahead.
We have some answers. Taking the time to wash hands or using gel before touching anything else. So,
Good.
just education on those steps. Constantly reminding them to keep everyone safe. I think we must constantly watch and wear our mask. I think I had read that one. Repetitive education and reinforcement, keeping their environment clean frequently, and teach. Getting into a routine of frequently washing hands, infection control of cleaning, routine of each shift at work, wearing gloves. So looking at the processes there, being very observant for them because our clients don't really care about safety sometimes, and just reminding them about being safe and being cleanly. So again, you will care for those who disagree with what you're telling them. So your approach is, again, reminding them, constant education.
And somebody mentioned gloves, and
Mhm.
gloves don't necessarily protect you from what we're talking about today. You can move a fomite from one area to another wearing gloves. And so you have to be conscious of, if you're wearing gloves, that you are still not touching those areas that you shouldn't touch. And you should change those gloves and cleanse your hands when you go from one point to the other. You don't want to do pericare on somebody wearing a pair of gloves, and then keep those gloves on to go move things around in their room. You need to take those gloves off, cleanse your hands, and then work with them on the rest of the things. Good thoughts, everybody.
Yep. I like this one, and it's working with the client or the person you're caring for to encourage them to wash their hands at the same time. So using that, modeling the behavior you want to see and encouraging that person to do it at the same time as you, and hopefully set a routine. So it's a great example as well.
I have to say, I'm a grandmother of a 4-year-old and a 2-year-old and a newborn, and I love hearing my 2-year-old and my 4-year-old grandsons singing the ABC song as they're washing their hands. And if their parents go in the bathroom with them, they're singing the ABC song, modeling that behavior to their children. And it's so fun to hear the kids when they don't have mom or dad in the bathroom with them, and they go in and they wash their hands. And to hear a 2-year-old sing the ABC song is just the cutest thing ever. But he's learning the concept that he needs to wash his hands as long as he's singing that song. So it's good behavior modeling. So, what are some possible strategies that we can think of in our work environment? I'd like you to close your eyes and really imagine yourself in your work environment. Think about all the routines and environments in your daily work. And in thinking about this, I'd like you to spend a moment thinking about strategies that are in place or that could be in place to help us all keep germs from spreading to surfaces or from surfaces. What are some possible strategies we could use to help us remember to protect ourselves against this kind of disease spread? Think about what your facility does and what you can do. So I'll give you a minute to think about that. Would anyone like to share a creative strategy that you identified in your thoughts? How can we support each other in keeping germs from spreading from surfaces? So this is taking it more just from us internally too, to how we can support each other.
In chat, we have cleaning routines, keeping hand sanitizer close by for easy access, many times a shift at strategic times. So tables after and before eating. So while you may have some cleaning once a shift, also look at those high touch areas, surfaces, and have cleaning appropriate to that. Posting reminders that are eye catching. I like that one too, and wonder about, do you give those reminders for your clients to post at their house so they remember when you're not there? We have each shift, we have infection control cleaning tasks from the door handles to surfaces, wearing their PPE, disposing of that PPE correctly. We have, for isolation rooms, we have small tables outside the doors with hand gel and sandy wipes to be used going into and out of those rooms, making sure all PPE is full so they don't have to go search for PPE when in a hurry. Great approach. Clean work areas and desks frequently, keep hand cleaner readily available, keep Kleenex on desk and work lobbies and stations, and again, consistent cleaning routines.
This particular slide reminds me of a scenario that I'll present to you all, and how could we handle this situation differently. This is a work experience in which the facility that I was working for, we had probably what was norovirus going around our facility. We had a pretty significant GI bug that was causing nausea and vomiting and diarrhea, mostly diarrhea. And the population was an elder population who actually went out to a dining room for meals, went into therapy gym and did services. And this particular virus went through every patient we had. Then it went through all of the staff. And then it was starting to come back around again. And so as the infection preventionist for the facility, I was putting signs on bathroom windows or bathroom mirrors and, encouraging hand hygiene in the dining room. And I was walking through the dining room, and there was a gentleman who had been a cook in his career time. He was elderly, so he was obviously well retired. And he was telling me how he knew how you people do this and the things that you need to do. And the whole time, because he'd been a cook and he knew how to do it. Well, the whole time that he's saying all of this, he had his napkin that he had blown his nose on, wiped his face with, and he was wiping the table down with that same napkin. So and you guys are going to encounter situations like that. What could be done differently to, because it's hard to stop that behavior. How could you get creative to manage that type of situation? What could you do that would help?
We have a question. Do you mean manage the person
Just
or the behavior?
manage the behavior. How could you mitigate it so that instead of him spreading something all over the table, maybe he's doing something helpful? Or what could you do? What could I have done? I can think of one thing, actually. Maybe if I had gone to him with a wipe and said, "Hey, Mr. Jones, you're doing such a great job cleaning that table. Let me give you the right tool to clean that table," and get rid of the contaminated napkin and give him a wipe, a sanitizing wipe to wipe down the surface of the table. He's obviously not going to clean it to the degree that you needed it, but it would help quit.
We had a chat waterfall of that about giving him cleaning and providing the appropriate cleaning wipes. So right as you started, we had a lot of those responses. I want to back up 1 minute. I had something come in I thought was a great idea. I want to come back to education, so before we miss it. But it talked about doing some sort of group activities and crafts about the germs, so that you're engaging education and an activity kind of all in one and catching those different learning behaviors. So I just thought that was
That's
really a great example. So before it got lost in chat, I wanted to make sure I shared that with everyone.
a great idea.
And then we have about the cleaning wipes, hand him the right solution for the table, and then again, let him be a part of that sanitizing crew. So giving them the supplies, giving them a purpose, and letting him engage in that activity.
Great. Those are great suggestions. And many of you are in environments where if you can engage and connect those folks to the activity, it helps. There's more than one motive behind it. Thank you for that. So today we had the key messages of although COVID is mainly spread through respiratory droplets, another way you can get sick is if you touch something that has live virus on it and then touch your face without cleaning your hands first. And norovirus is a good example of one that lives for a while on a surface. So that's a good virus that spreads that way. Viruses can get on surfaces when respiratory droplets land on those surfaces. And viruses also can get on surfaces when body fluids from an infected person like spit and snot get onto things nearby. My gentleman in the dining room was a classic example of transferring things through that modality or that method. I hope that you have enjoyed today's talk. Here are the links that Dr. Carlson references to. And next time we will review how COVID-19 specifically spreads. And in the meantime, you can keep exploring those topics on your own using the Project Firstline on CDC, the Facebook, Twitter, YouTube, those kinds of things. And reminder, you can always sign up for Project Firstline emails so that you'll get notifications that way. And please always give us your feedback. Let us know how we can help you with this. Hopefully this is all going well for you. If you have any suggestions or thoughts on what we can do differently, we really do like to hear that. If there's additional items that you would like some education on, there's nothing stopping us from continuing this series beyond what we have scheduled and targeting some of those things that you would like to hear about. So feel free to type in the chat. We'll leave it up a little bit if you want to type things in the chat. We always wait to close it out so that we can capture chat conversations. And we thank you for your participation and we look forward to next Friday. Have a great weekend, everyone.
It is super windy outside.
It is. I would agree. Super windy. I was watching it. It's talking about things falling and I'm watching the leaves fall. Her example of leaves falling was quite relevant.
My husband's American flag keeps flying off. I've been out twice today to pick it up and put it back. I think I'm just going to have to bring it inside. So I'm going to save this and I'll close this out.
Well, I'm glad everything showed today for a change.
All right. We'll see you guys later.
My screen looks different again today than it has.
I had the ability to put a background on today and we didn't have it yesterday.
I did not have. So that's, yeah, it's crazy. It's just bizarre.
It worked for us today.
Good. Bye.
Bye.
Bye, ladies.